Okay, we're going to tee up the next talk. I think if anything can potentially reduce stress and mental health and suicide, it's a dog, if you're a dog lover. It's a kitty if you're a cat lover. It's an iguana if you're an iguana lover, but certainly the next talk, I can't even, I don't even want to surmise what it's going to be because it's so fun and innovative. And I have a chocolate lab, love dogs, and the next two speakers are going to be presenting on Dr. Wirth and Dr. Mead will introduce a new research project that will develop, implement, and evaluate an integrated health protection and health promotion program for corrections workers that they're currently piloting in a federal minimum security prison. And they will discuss how animals are impacting both veterans, returning veterans with PTSD, and corrections officers. So they really don't need no introduction. Normally when I get introduced, because I have a BS, MS, DRPH, and an MD, my work partner introduces me as Dr. Keel has more degrees than a thermometer, but somebody beats me today, and I get to use this. Dr. Mead has 5 degrees. And she's got more degrees than a thermometer. So Dr. Wirth is a research psychologist at NIOSH. Dr. Mead is a medical officer at NIOSH, and they're going to present an innovative, integrated approach to corrections, protection, and promotion. So thank you, Dr. Mead and Dr. Wirth.
Well, thank you very much, Carrie. Jean and I are very pleased to be here. We're both new to the corrections field, so we're really excited about stepping into it and being able to propose some new, what we think are innovative ways to maybe deal with some of the stressors that corrections workers deal with. And I'm looking at the clock. I think I can accelerate my portion of the talk. I don't know about Jean. She can go on forever, but I think we'll try to still get us out on time here for lunch.
Jean, if you do want to sit here,
I'm good.
Okay.
I want to poke you.
She might interrupt me. And Jean is 3 or maybe 4 times smarter than I am because of her degree, so she might have to steer me straight a couple times. Before we talk about the details of the project that we're proposing to do at NIOSH, there is some other programs and projects that are somewhat related and that gave rise to our interest in total worker health in a prison setting. We're going to talk a little bit about that history, and then we're going to tag team a little bit too. Jean's going to step in and talk about some of the work that we're doing with service dogs, and then we'll wrap it up with some details about the project itself. Of course, we've heard all this morning from Mitch Morrow and then from John. We all are aware that the stressors that corrections workers face, and of course the outcomes of those exposures are quite startling. Some of just a few statistics that I came across suggest that they have the second highest injury rates from assaults, and that's only second to police officers. They have the second highest mortality rate, and the average life expectancy is only 18 months past retirement. And of course, we heard already that they have a much higher rate of suicide, divorce, substance abuse, and other problems compared with the general population. So, they deserve our attention and more research, obviously, within the NIOSH program portfolio, and that includes the intramural research program as well as the external programs projects that we fund. Corrections officers and corrections workers, any research related to them is really underrepresented. I'm only aware of 1, maybe 2 projects that involve corrections workers, and so we see an opportunity to do something in this area. Combining that with Jean and I are both involved with the NIOSH Total Worker Health program, as many of you are aware of. It started out as work life. In 2011 became Total Worker Health. And again, the key is the integration of health promotion and health protection programs. Both Gene and I serve on the steering committee for this program, and so we've been interested in this topic and doing something in total worker health for some time. Combining that with with the opportunities for doing some more work with corrections workers, we envision this new project, which is the integrating health and safety program for correctional workers. These are the 4 aims that we have. Again, the details are going to come later. I'm just going to go briefly over these aims. But what we want to do is develop a total worker health program. We want to implement it in a prison, and there's a local prison that we're working with, for the purpose of stress reduction. And there's a novel aspect of this that involves the opportunity to walk a dog as a means to get some exercise. We want to evaluate the program, short-term and long-term, with some health and performance metrics. And we're very interested in participation rates, because I know that a lot of prison systems are interested in wellness, and they're interested in fitness, and there are a lot of good programs out there, but low participation rate seems to be a big barrier to limit the success of these programs. And so we are really thinking, how can we increase participation rates? And we see the option or the opportunity to walk a dog as perhaps providing that incentive. The site that we're going to be working with is FCI Morgantown. It's a Federal Corrections Institute. It's a minimum security prison. There's 1,100 male inmates, about 176 employees, and that includes correctional officers as well as the administrative staff, maintenance staff, medical and psychological personnel. It's actually a very nice campus because it's minimum security. You can see the aerial view there. There are 321 acres, and around it is a 1-mile perimeter road, access road, and they even have a track on site too. And so there are many opportunities for walking by the staff to get some exercise. And they also have a service dog training program that was just begun about a year ago. And so there are dogs available for us to potentially use for this walking program, and Gene is going to talk more about that. Our interest in service dogs and the potential therapeutic effects that service dogs can provide folks with disabilities is another, it's sort of been our interest for some time. We have an existing NIOSH project that we call ROVER, stands for Returning Our Veterans to Employment and Reintegration. It addresses NIOSH's interest in return to work issues and also with the population of veterans. For a long time, veterans were not on the radar screen for NIOSH. That was sort of a VA problem, a DOD problem. But recently, NIOSH has begun to recognize that veterans do deserve our focus and attention in terms of research. And so this Project Rover has been initiated to address some of those issues with those veterans. But we're also interested in looking at the therapeutic role that service dogs can play in helping veterans return to work and help deal with some of the stressors as they're trying to reintegrate into the community. The project, just briefly, I'm not going to go into a whole lot of detail, but we have 2 national surveys that we're administering. We have focus groups with veterans, and we even have a laboratory-based study where we're actually looking at work simulations, and we're bringing veterans in and look at their physiological reactivity to some stressors that we're creating that are like work-type stressors. And then we're also going to compare different conditions where they're going to be allowed to interact with dogs. And we're going to look at the presence versus the absence of the dog, and does that make any difference in their reactivity to the stress? So that, again, as part of our background, we've been interested in animal-human interactions for some time, and it just sort of kind of gave rise to this new project. And so, Gene,
All right.
I'll let you pick up from there.
Okay. Well, I just also wanted to thank Carrie for the invitation to be here today. It's a really exciting time in my career. I mean, this project allows me to bring all of my background together and synthesize it in a new field and an exciting field. And being involved in the correctional officers program now gives us a really good test environment. I mean, if this thing's going to work, this certainly is going to be a place that we can prove that. So let me backdrop a little bit and talk about why dogs. Why do we feel like dogs may indeed have an impact? There is a tremendous amount of interest in this field growing right now. We went back as one of our first tasks and looked at the literature. And there's a broad-based literature in the field of the impact of animals on human health, but let me start by saying that it's not a real strong database. And so we feel fortunate getting in on the front end of correctional officer health, but also in helping to bring some stronger science to the field of animal-assisted interventions. When you look at the data here, I've highlighted in red all the journals where this data has been published, and it sort of brings to light the variety of disciplines that have interest in the fields, all the way from psychology and health to hypertension to medical journals, public health journals, and a lot of this comes out of the gerontology literature. So if we go back, and part of this interest in looking at the effect of dogs and animal interactions on health, again, goes back to BCOPS. It seems like everything comes back to John today. But, you know, when they looked at the effect of stress on police officers and the negative impact on cardiovascular health, we started looking at what little literature, strong literature there is there of the effects of animals on health. And there are some studies that show that indeed interacting with animals reduces both blood pressure and heart rate. There are two published studies here that we highlight. One is in normotensive individuals, so people that don't have problems with elevated blood pressure, that petting a dog or being allowed to pet and interact with a dog during stressful mental tasks, and they used arithmetic here, reduced heart rate and blood pressure. Another study looked at people that do have very severe hypertension, and I believe that these blood pressures ranged up in the high 180 systolics over 112 diastolic, and it was a study using lisinopril, a drug that's an ACE inhibitor that's used for blood pressure alone, or a drug pressure medication along with interacting with the dog. And the lisinopril dropped the systolic and diastolic blood pressures, but when people were allowed to interact with the dog, again, when doing stressful mental tasks, their blood pressures decreased even beyond taking the blood pressure medication. One of the very first studies that got a lot of attention related to cardiovascular risk in interactions with dogs was Freeman's study, where he followed up individuals 1 year post heart attacks, and there was an increased survival rate in pet ownership. And this was independent of other psychosocial supports that were in place and independent of the physiological condition of the person. So it wasn't just that pet owners had less severe heart disease, and it was a correlation. Now, one thing that I need to point out is that the great majority of the literature out there really is correlations at this point, and we need to do a little more work in terms of causality. If you look at sleep disturbance and fatigue, there are a couple of published studies that indicate that, again, these are mostly pet owners as opposed to the kinds of situations we're talking about, but pet owners make fewer doctor visits and are less likely to be on medication for sleep difficulties. This study by Hetty is a really interesting one, and they are very upfront. It's a study out of Australia. It's a large survey-based study, and they're upfront about the assumptions that they made, but they also did an economic impact study along with this. And so they were looking at pet owners versus non-pet owners, and the numbers of doctors' visits to their primary care physicians and the numbers of medications that they were taking related to cardiac issues and sleep. They took that data, and in the Australian system, people get their entree into healthcare through their primary care provider. So they used the reduction in doctor's visits as an estimation of reductions of overall health care, and came out with a calculation that they would save $1.8 billion, 5% of total health care expenditures, if everybody in Australia owned a pet. Now, that's a bit of a stretch, but that was sort of, their economic analysis of comparing pet owners and non-pet owners and their health. So if we look at sedentary behaviors, again, and this is one of the things that we're talking about with our correctional officers in this study, can we engage people in going out and walking more by giving them the opportunity to walk a dog? And these studies come out of Canada, out of Japan, and out of the U.S., that dog walk owners do walk more than non-owners. They walk longer, and they have higher physical activity levels. Not many studies have been done on work stress and work organization and the presence of pets, but there have been few. And if you'll notice along the bottom here, we have the dog in the White House and the dog at Google. Somebody brought up Google and how these are very different, but there is a trend more in the U.S., certainly more in Europe than there are here, but in bringing dogs into the workplace. And these studies have shown that work stress levels do tend to decline over the course of a day in dog owners that bring their dogs to work, but that if they leave their dog at home that day, their stress increases over the day at the same rate that non-pet owners do. And then there was a survey of companies that allow pets in their workplace, and the employees perceived that the dogs did reduce their stress levels and impact their health. So how did this project originate? Because I can't stand here, and Oliver and I can't take credit for the origin of the FCI Morgantown program. And if you're going to talk about a total worker health project, this sort of is it. This project was actually initiated, and I need to give credit to two people at FCI Morgantown. One is the warden, Warden Carter, and the other is a unit manager, Mr. Miller. And they actually reached out to us and asked us to bring this service dog program into the prison. And I finally, as I got to know the warden, up front they talked about how important this would be to their veteran inmate population. And one day I said to her, what really made you think about dogs? And she said, okay, Jean, I'm going to tell you the truth. She said, I came to interview for this position, and you see how beautiful this campus is, but there was duck poop everywhere. and I said to myself, how do you get rid of the geese and the ducks? Because they were there's a beautiful stream that runs through the place. The geese were overwintering there, and this is not an image of FCI Morgantown, but it could have been. And this chart down here is realistic. I found this on Google, and Oliver said, is this true? Do geese really have that much waste material a day? And it's actually an underestimation. It's 1.5 pounds per every goose per day. So she said, how can we get rid of the geese? And she went, you know what? I've heard about dog programs at prisons. If we had dogs here, these geese would be gone. And so that's how it started. It started based on geese. And so you talk about total worker health protection. Geese carry a lot of zoonotic disease. And there's problems with slips. You've heard that expression about slippery as goose poop. Well, it's preventing slips and falls and preventing zoonotic disease of GI infection and potential respiratory infections and cleaning up the place. But what has happened is something that has greater value than that, I believe. This is our group, our initial group of veterans that started in with the project. We have 20 inmates that are involved as trainers for the dog, and about another 10 that are involved in maintenance type work. It was initiated out of a West Virginia University program that we started about 8 years ago, and I say we now as an adjunct faculty member in the Division of Animal and Nutritional Sciences. They teach 3 courses there in service dog training to their pre-veterinary students and their pre-med and ancillary allied health students. It increases disability awareness and gives them some companion animal training. So when they reached out to us and said, can you bring this training program there, we took the educational program that we had for the students and compressed it a bit and teach it to the inmates. The warden is a remarkable person. I have been so impressed with her, both in terms of her concern for her employees as well as the inmates there. And she said, you know, I know our veterans are in prison because they committed crimes, but they served our country. And part of the reasons that they're incarcerated are because of some of the mental health issues that they face and problems with employment when they come back, and we owe them a service. And so she initiated this program for that purpose. And so we started about 6 months ago, and we have done a 6-month review of the program. This is, again, it's based off of our university program, and it's important, I think, to grasp what the training program consists of to understand the impact that it has both on inmates and correctional officers. It's a totally positive reinforcement training program. The animals are not physically corrected in any way other than possibly a very slight pull on a leash for correction. The inmates have to use very high-pitched voices in order to get the dogs to respond. So as you can imagine, this group of big burly inmates going, "Yep, good puppy, good boy." It's all over the place. And it has an effect on the whole environment of the prison. When I first came in about 2 or 3 weeks after the dogs came and talked to the warden and asked her what she thought the impact on the inmates was, she said, "Jean, you know, we're missing something here. I didn't expect this, but this is impacting our correctional officers. We're having people call and saying, can you have an inmate bring the dogs to my office? When things get tough, people say, I want a break. I'm going to go see the dogs." They are asking for the dogs to be an integral part of their day. So when we did our 6-month evaluation, we met with every inmate individually, and we asked them how they felt it was going, what changes we needed to make, and what impact it was making. And this is a list of the kinds of things that they said. I put this picture of the little dog with a strip of bacon on his nose, and this is realistic. I mean, this is the kind of thing they're training these dogs to do. You have to be consistent. You have to be patient. So we're modifying their behavior as they're modifying the behavior of the dogs. They talked a lot about the importance of job skills. You know, they're in there, they're now a felon, they're going to have to come out and find a job on the outside. That's not easy to do, so they tell me. And they said, you know, this is something we love. You know, their affects have just been really narrowed when they're, you know, a lot of these guys had mental health problems when they came in, or drug abuse problems, and then they develop what people, I'm new to corrections, but they say there's this mentality when you come in of the inmates that you take care of yourself and you focus on staying in line and getting the heck out of there. And there's no sense of community. It's creating a sense of community amongst the inmates because they can't train these dogs individually. They do it as a group. It's building teams. And so they say, you know, probably I would say 60 to 80% of these guys tell us that they want to work in some animal-related field when they get out now. So we have a meeting set up with the Department of Labor. There is an apprenticeship program. They have numerous apprenticeship programs at the prison, but there's evidently one on the books in animal training. So we're going to try to bring that Department of Labor approved apprenticeship program, which is a 4,000 hours, that they will leave with a certification in animal training that hopefully will help them gain employment. There's some literature that I didn't show, a program out of Australia that, again, not a real rigorous study, but showed a decrease in recidivism in inmates that worked in an animal training program where they rescued greyhounds and trained them just to be adoptable, and they showed some reduction in recidivism there. These guys have a tremendous pride in helping wounded veterans. Once these dogs are trained, they're placed with veterans with disabilities. We had our first veteran come in. What we do is about 2 weeks to 2 months before the dogs are placed, we do the selection of who they're going to go with, and then fine-tune the skills of the dogs to match the needs of the person that will accept it. The young man rock climbing with his dog was the first veteran that got a dog out of the prison program. This dog spent his last about 4 months being trained there. This guy came in and told his story, and I had talked to Josh numerous times before, and never had he opened up the way that he did to these guys, telling the really horrible details of his PTSD. And he talked about not being able to sleep in bed with his wife anymore because she'd woken up with black eyes too many times. And when he woke up with his arms or his hands around her throat, he decided something had to be done. And so they trained his dog to monitor his heart rate. He wears a monitor. When his heart rate hits a certain level, the dog wakes him up safely. And so it's, it's that kind of thing. And these guys are taking incredible pride in being able to provide a service while they're incarcerated for, again, other veterans. When we held the graduation exercise, it was for the inmates that were training, but we opened it up to anyone who wanted to come. And it was amazing the number of correctional officers and employees that came. And they, too, are taking pride in the work that the prison is doing, aside from just the correctional work of helping to provide dogs for veterans with disabilities. And so the warden did a little survey and got back comments from the employees, because they didn't know. Were they going to see this as an extra burden? Was it going to be extra work? Are there people that don't like dogs? There was not a negative comment received. Most people wanted to see more dogs. They wanted the employees to be able to participate in the training. They wanted to be able to dog sit when the inmates had to go somewhere they couldn't take the dogs with them. And of course, they wanted them to chase the geese. So we see this as a win-win-win situation. The VA and the Department of Defense have made a determination that they will not provide benefits to veterans with psychological disabilities at this time because they say there's no empirical data to support it. There are currently 2 studies being funded, one by the VA and one by the DoD, to begin to collect some of that data. If indeed they come back and say, yes, we will fund these dogs, there are not enough dogs available. Oliver talked about the surveys that we've done. One of them surveyed all service dog providers, and we asked them what their wait list was currently. This is without the VA providing benefits. And the responses came back predominantly at 1 to 2 or 2 to 4 years that individuals are currently waiting. The inmates are doing a much better job of training these dogs than our students at the universities do. We have 7-month-old golden retriever puppies that are performing at the rate of the 2-year-old dogs in the university program. It's their job. They're paid to do this, and they do it 24 hours a day. There's a lot of oversight. It's a controlled program. And so I think prisons would be a wonderful place to train these dogs. So it's a win for the inmates. It says some of them, and the psychologist has come to us and said, we've had guys that haven't hardly spoken to anyone in the 5 years they've been here. These dogs are opening them up. They're making a connection with a dog, and it's facilitating interactions with other people. People will come up, and we got the same thing from people with disabilities in a wheelchair. They say it makes the chair disappear. People come up and talk to them about their dogs, not about their disability. The employees at the prison are coming up and talking to the inmates about their dogs, not about why they're incarcerated or, what else is going on there today. So it's creating a very different environment. So it's a win for the inmates. They say, some of them told us that they have something to talk to their families about now when they call. They talk to their kids about dogs, and it brings that back together again. It's a win, obviously, for the veterans that are receiving the dogs. And our question is it going to be a win for the correctional officers and the employees in the prison? Oliver's stepping up, so I got to give it back to him.
Thanks. left me no time.
You have 15 minutes.
As you can tell, Jean is very passionate about this, and anybody that she talks to about this just kind of, you just feel obligated to help, and so and I got sucked in as well. But this is this. This is just briefly, and I'll try to wrap this up really quickly in the last few slides here. The design of the Total Worker Health project now focused on the employees. I'll just briefly give you a little bit of an overview of what we're doing. Now, this is still kind of evolving. We're still working with the warden and the other prison staff to kind of figure out some of what's feasible and what may not be feasible. But right now, this is kind of our working draft of what we want to do. We were starting out with approximately 170 employees. What we want to do is for the total worker health part of this, we want to help them implement a sort of an education and training program. Currently, they really don't have anything in the way of wellness training, any health promotion training whatsoever. They have in-services every year that all the employees have to take that just talks about the EAP program and maybe a little bit of stress management and safety, but that's the extent of it. And so we really want to help them ramp up some of the education and training materials that they offer with respect to health promotion. And we're actually hoping that this group, and maybe with collaborations with Kerry and his group, we might be able to come up with a really good program. Obviously, we want to incorporate the importance of exercise, diet, sleep, stress management, all of that. We want to have part of the package. This will be presented to all of the employees as part of their training, mandatory training. And then we also want to offer some health status screening to volunteers. We want to get a health history, get some measure of activity levels, risk factors, BMI, maybe some other anthropomorphic measures, and present that information to the employees as well, and maybe some of them who see themselves at high risk for certain illnesses maybe might help motivate them to participate in the exercise intervention part of this. And that's the exercise intervention part of this is the walking programs, where we want to make available to all of the employees at the prison, not just the correctional officers, but all of them, 30-minute sessions at least 5 times a day from early morning to early evening. So we want to try to have a time so that employees of all 3 shifts would be able to participate. We want to encourage them to participate at least 5 times a week. And what we're going to do is have 2 conditions where we're going to offer an opportunity to walk with a dog and walk without a dog. And in fact, we want to use a randomized crossover design where the volunteers will first be assigned to one of those conditions, and then after 3 months of evaluation or so, then they'll be switched to the other condition. So we'll be able to do some within groups comparisons there. Again, we're actually working with them now to maybe extend that evaluation period and maybe instead of just A/B sort of design, maybe do A/B/A/B just for more control. Just briefly again, some of the outcome measures across the different phases of the project. We have the first part, which is just the education and training part. And this will be offered to all the employees. We'll do some knowledge and awareness assessment. We'll offer their health screening, and then the intervention walking program. At this point, we're thinking up to about six months or so of evaluation, but we want to do some self-reported measures of job stress, generalized stress, job satisfaction, fatigue, sleep patterns, and so forth, collect all those measures, and then also for each walking session, the 30-minute walking session, we're going to give activity monitors to the walkers. We think that we get a measure of actual physical activity while they're walking because as Jane mentioned, we think that when walking a dog, the quality of your exercise may improve. You might walk at a faster pace, you might walk for a longer duration, and so we'd like to capture that and measure that. And we're also going to get blood pressure, heart rate before and after as well. So, and then we have some post-intervention and follow-up assessments. We want to see if there are any short-term gains from this in terms of some self-reported measures, but we also want to look at some organizational metrics, absenteeism, utilization of EAP, and so forth, and do that immediately after the intervention, but also longer term. So we hope to do some follow-ups, 12 months, 18 months afterwards. Just some future directions. As I mentioned before, we hope to work with with Kerry and his group to consider some ways to ramp up their education and training with respect to total worker health. Of course, we hope to, this is sort of a pilot project, and we really hope to learn from what works and what doesn't, and hopefully implement this in other prison systems across the country. And it also relates to our general interest, as Jean mentioned, that this idea of human-animal interactions and the role that animals can play in the workplace. This is something that there's really not a whole lot known about. There's certainly not a whole lot of empirical research. What you do see is talking about all the positive benefits that are purported to come about from animals in the workplace, but there could be a lot of problems, health and safety related, and we think NIOSH would be in a good position to kind of look at that issue and maybe provide some guidance. Just to acknowledge our collaborators, we work closely with West Virginia University, which is in Morgantown, and Mary Ann Carter and Ed Baker at FCI Morgantown. So thank you.
So we have a few extra minutes here. We're going to take a few. So ask any questions about the program or anything. So we will be eating lunch here and getting boxed lunches, but we can entertain questions for a few minutes.
So we talked about the health improvement with the inmates and everything, but what about the incentive to be well behaved to get into the program? How did that affect the inmate population? Did you look at that?
That's a great question. We did, someone asked me last night whether we had concerns for the dogs going in, and I will tell you, as a veterinarian, my primary concern with this going in was the health and well-being of the dogs. So we had a very rigorous screening program, which we hope to package this entire program to be able to disseminate it. So the first phase was the warden and the captain went back through all of their history. I got ready to say medical history, sorry about that, but went back through their correctional history. Anyone that had a history, and this is minimum security, so child abuse, animal abuse, any violence in their background, they weren't even interviewed. We then had them fill out an application. Part of it was writing an essay of how you thought this would impact you and how you would use these skills when you were released. And then we sat down again with the unit manager, a couple of the caseworkers, the assistant warden, the warden, and interviewed all these guys and made selections. They were told up front that any behavioral infractions, they were kicked out of the program. The program's been in place for 6 months. We have lost one person, and it was because of smoking. So it's a great incentive to be on your best behavior. I was concerned when we came in that this was going to be novel and new, and we started with 8-week-old fuzzy golden retriever puppies. I mean, who doesn't want to be part of that? And, these guys had to house train them. They were getting up every 2 hours all night long to take these dogs out. I thought, they're going to get tired of this. I was in there last week. They are every bit as enthusiastic as they ever were. I walk in the front door, and the staff goes, "Are you going to bring some more dogs soon? We want more dogs." The enthusiasm is continuing to build. We have correctional officers asking to be transferred to the unit where the dogs are housed. So it's not that it's more work and nobody wants anything to do with it. It really has been one of the most successful programs that I've ever been involved with. Admittedly, it's early, and we haven't put any evaluations in place. And like I say, this did not start as a NIOSH initiative. It started through West Virginia University, and it's just a great opportunity for NIOSH to get involved. Yes? Anybody?
Thanks. I was just wondering if you have any plans to expand the program into facilities that already have puppy raising programs. In Oregon, we have a women's prison that does puppy raising. We also have Project Pooch, where youth take shelter dogs, rescue dogs, and
what the answer to that is yes. We would love to expand this program, and like I say, I've been involved with another program in a women's maximum security prison at Hazleton. Our I'm involved with a nonprofit organization, and our nonprofit with another one started a program there. And it has continued. The other organization took over after we established it and continues to run it. I don't know how well, when you say go into prisons that already have programs, there is, it's like a lot of different disciplines. Somebody was talking earlier about the competition that you get into with academics. Amongst service dog providing organizations, there's also a lot of competition because resources are limited. So we're not trying to push anyone else out. There are plenty of prisons out there that don't have programs at all. We certainly would love to share what we learn and share our protocols with other organizations if they're interested, but we're certainly not trying to get in competition and push people out that are already entrenched in facilities.
Follow up?
Yeah.
In terms of adapting a program, I guess that's what I meant. Can you adapt an existing program for the dog walking part for employees? Because that's not part of what those two programs do right now.
Once we get this in place and have that protocol, I don't see why and there are, and I wanted to bring that up, this is not novel. There are a lot of other prisons that have dog programs. They vary from behavior problems with shelter dogs, lots of things. But I see no reason that they shouldn't be adapting those. It's good for the dogs for socialization, and it's obviously, or I shouldn't say that, we hope to show that it will be beneficial for the employees. Oliver, do you want to add something to that?
I was just going to say that, yeah, one of our reviewers commented on that in terms of the widespread applicability of this type of approach in other prison systems. And because there are dog training programs in other prison systems, I mean, and the dogs are there, it just makes sense that this is something that could be adapted regardless of the nature of the training program. The dogs are there. Now, we're not sure if it would, we're working with a minimum security. I mean, with maximum security penitentiaries, there's obviously some other factors that will be involved in terms of handing the dogs off to the employees or whoever might be in charge of that, but those are logistics that we will tackle later on.
And Oliver talked about health and safety issues too. I mean, if you talk about programs that are trying to rehabilitate shelter dogs, and I know there's some programs that actually work with behavior problem dogs, so you have to be concerned about the safety of novice handlers and passing them off to employees. We don't want to create problems. Yes, ma'am.
Can you say just a little bit more about what happens? Is there a program to train the dogs about the environment? There's things that they're going to encounter when they go with the veteran, as a service dog that they don't see in the prison. Do they go with a family on the weekends? Could the DOs take them home on weekends? How does that work?
Another great question, and one of the reasons that it works so well in a minimum security prison, we have our one trainer, and then we have teaching assistants from the university that come in and assist in training. And the students take the dogs out on weekends and for field trips. But again, because one of the requirements, well, that's not true. They're not required to have community release, but of the inmates that are in the program that do have community release, they actually take field trips and take the dogs out. And one of the things that the warden had said there was that it would need to be the university's responsibility to oversee these guys. The correctional officers want to go. So they're requesting that they get to go out in the field with them. So it gets them out of the prison and into the community, but our students do take them as well. Yes, ma'am.
Just a question for you. You mentioned an activity device that was used.
Yes.
Can you explain a little bit about what that
It's
was?
the little wrist, so the wrist watches that can, they have some that are research grade that are a little bit better and can do a pretty good job of recording activity and sleep as well. So, yeah.
It's a lot of fun. Okay.
Thank you.
Thank you.